Hello everyone, I'm Dr. Priyanka and I'm back with my channel Learn with Dr. Priyanka Gehlot. After a long break, I'm back to business. Today's topic is difficult one, but I'll make you understand in a very simplified manner. The blood supply of perineum and pelvic structures. So, the aorta gives branches to two common iliac arteries, right common iliac and left common iliac arteries. These common iliac arteries further give branch to external iliac and internal iliac arteries. Now the internal iliac artery is the main artery which will be supplying the perineum and pelvic structures. But before going into internal iliac artery, we must learn what happens to the external iliac. Now the external iliac arises from the bifurcation of common iliac. It proceeds along the medial border of psoas muscle and it exits the pelvis inferior and posterior to inguinal ligament. Before exiting the pelvis, it gives two branches, inferior epigastric artery and deep circumflex iliac artery. This inferior epigastric artery will give supply to rectus muscle and this deep circumflex iliac artery will give supply to internal oblique and transversus abdominis muscle. The external iliac artery, when it exits the pelvis, it converts into femoral artery. This femoral artery will give supply to lower limbs. Now coming back to internal iliac artery. Internal iliac artery is further divided into anterior division and posterior division. The anterior division basically supplies all the uh, pelvic organs and the posterior division gives rise to three branches, iliolumbar artery, lateral sacral artery and superior gluteal artery. The external iliac artery, when it exits the pelvis, it converts into femoral artery. This femoral artery will give supply to lower limbs. Now coming back to internal iliac artery. Internal iliac artery is further divided into anterior division and posterior division. The anterior division basically supplies all the uh, pelvic organs and the posterior division gives rise to three branches, iliolumbar artery, lateral sacral artery and superior gluteal artery. The posterior division is not so important for our purpose, but still we can remember the arteries from a code that is ILSG, iliolumbar, lateral sacral and superior gluteal. Even if you don't remember, there is no problem. So we'll focus on the anterior division. The anterior division, as you can see, I have given a mnemonic for the branches to be remembered. The anterior division basically supplies the structures of the pelvis. The code is SOMU VIP. S stands for superior vesical artery. The superior vesical artery supplies the upper part of bladder. See, there is vesicle in the name of superior vesical artery, which means bladder, so it will supply the upper part of bladder. O stands for obturator artery. So, as the name suggests, it will cross through the obturator canal and it will go outside the pelvis and it will supply the muscles of thighs and head of femur. M stands for middle rectal artery. As the name suggests, rectal, that means it will supply the rectum and anal canal. U stands for uterine artery. We'll study later about its branches. It will supply the uterus. V stands for vaginal artery. As the name suggests, there is vaginal in it, so it will supply the upper part of vagina. I stands for inferior gluteal artery. As you can see that it has the name gluteal in it, so it will supply the gluteal region. Actually, these two arteries, I and P, inferior gluteal artery and internal pudendal artery, they both exit the pelvis through greater sciatic foramen. The inferior gluteal artery is the major terminal branch of internal iliac and it supplies the gluteal region, and the P stands for internal pudendal artery. So in our case, internal pudendal artery is the main branch we have to focus on. So I'll tell you the branches of internal pudendal artery. So see the internal pudendal artery, how I have made the branches. It looks like a pida. Pida, you'll understand. It's like a table on which we sit. So the code is PIDDA, PIDDA. So let's see what PIDDA stands for. Internal pudendal artery. The P stands for perineal artery. Perineal artery supplies the superficial perineal muscles. Okay, and then it branches into posterior labial artery, an artery to the bulb of vestibule. Posterior labial artery will supply the labia, an artery to bulb of vestibule will supply the bulb of vestibule. I stands for inferior gluteal artery. Inferior gluteal artery will supply the anal canal. D stands for deep artery of clitoris. It supplies the corpus cavernosum of the clitoral crura. Another D stands for dorsal artery of clitoris. It is a direct supply of clitoris. A stands for artery of bulb of vestibule. So artery of bulb of vestibule can be a direct branch from internal pudendal, or it can be a branch from perineal artery itself. So internal pudendal artery you can learn by the code PIDA. Perineal artery, inferior gluteal artery, deep artery of clitoris, dorsal artery of clitoris, and artery of bulb of vestibule. Even if you don't remember all this, you must remember that internal pudendal artery is the artery which supplies the all the pelvic structures mainly. Now coming to uterine artery, this is the major artery which we will always encounter in our gynecological and obstetric part. So uterine artery is, it has ascending branch, main branch, and descending branch. The ascending branch has three branches: the ovarian branch which will supply the ovary, the fundal branch which will supply the fundus of the uterus, and the tubal branch. The tubal branch will supply the fallopian tube. So now the main branch. Let's come to the main branch. This is the main branch. This main branch will supply the uterine wall. So what happens in the uterine wall? Uh, the uterine artery, it enters the uterine wall perpendicularly. In the myometrium, uterine give rise to arcuate artery. This is the myometrium. You can see that these uterine arteries are making an arc like this. So it is known as arcuate artery. Okay. So the arcuate artery will be present in the myometrium. When it will cross the myometrium, it is known as radial artery. As you can see this is radial artery. It is radiating from the arch towards the endometrium. So this is also known as radial artery. Radial artery ends in two forms. One is the spiral artery and the other is the basal artery. So the spiral artery, it supplies the superficial layer of the endometrium, and the basal artery, this is the basal artery, it will supply the base of the endometrium. So you can see that the uterine artery, it has ascending branch, descending branch, and main branch. The ascending branch gives supply to the tube, ovary, and uterus, fundus. And the descending branch is also known as vaginal branch, it gives supply to vagina. And the main branch enters the myometrium and it forms arcs. These are arches. So the name is arcuate artery. It forms arcuate artery. These arcuate artery will give rise to radiating artery, that is radial artery. So radial artery, and these radial artery will end in two forms. One is the spiral artery which will supply the superficial part, and second is the basal artery which will supply the base of the endometrium. So basically this is the gist of blood supply of perineum and pelvic structure.